Good afternoon, colleagues, delegates, and staff. Thank you for joining us for our very first virtual House of Delegates meeting. My term as president has been very eventful. It came in like a lamb and is going out like a lion. Last year, I came to you with three goals. One was to focus on our components. The second was to enrich our membership through diversity and inclusion. And the last was to build a more open and inclusive leadership through technology. We have made great progress in all three areas, as well as many unstated ones. Let's get a little deeper on what the MDA has been doing for you this last year. Components are our lifeblood of our association. A prior survey revealed that members' rated value of the component varied, but it's critical for the personal touch point with members. It is also critical that our components have a process to continue a sustainable component, and that this is especially important with the increasing demands and challenges of volunteer dentists' time and talents. Our focus on components was started during Dr. Peters' term as president, and we continue the work group this year. The work group conducted surveys, visited with many components, contacted leadership and staff. They gathered data on the unique challenges from each society and developed a list. The result of their hard work developed into resolutions adopted by the Board of Trustees at the February board meeting. Now you, the House of Delegates, have a bylaws amendment in front of you. When adopted, the bylaws amendment allows for the merging of components. This will reduce the number of volunteers needed, make administration easier, and help components succeed in meeting member needs. I urge you to view the component work group webinar that has been placed on the website. This will help facilitate your discussions in your component and for the House of Delegates. Diversity and inclusion was a goal weaved throughout our year. In December, the Board of Trustees took a look at our forward-facing public campaign. It has resulted in modifying our Big Stories from Little Mouths campaign to be more diverse. I hope you've seen it. At our board meeting in February, we heard from Dr. Todd Esther, the Assistant Dean of Diversity, Equity, and Inclusion at the University of Michigan. Dr. Esther helped start a very frank discussion with our Board of Trustees. It resulted in our Board of Trustees supporting a change to the Michigan Civil Rights Act to be inclusive of gender, sexual orientation, and gender identity or gender expression. Our plan is to continue this discussion on diversity, equity, and inclusion with targeted studies to identify our gaps as leaders and look for ways to improve our association. The remaining priority was improving technology, specifically Zoom. Well, I think this House of Delegates proves we've accomplished this goal. We are going to be caucusing from our homes, voting in real time, and moving our association forward without being in the same room. I applaud our Speaker of the House, Dr. Todd Christie, and our staff for making a 180-degree turn in very short time to accomplish this feat. I applaud Macomb, Genesee, and the Superior districts that were willing to try Zoom for the first time for the presidential visits. Another area we've been working on is registered dental assisting. We had the opportunity to meet with DAMBY, the Dental Assisting National Board members, and their executive director. Many of you may be aware we have had closures of dental assisting programs in Michigan. Registered dental assistants are an integral part of our business, and without them, we will be less efficient. The Board of Trustees voted to support the development of an RDA shortage campaign. The RDA campaign has already launched in April and is targeting teens throughout Michigan to consider a career in registered dental assisting. Now, to address the elephant in the room, what about COVID-19? On March 16th, the Executive Committee voted to recommend office temporarily limit their practice to emergency care only. This recommendation came after we became aware of the shortage of personal protective equipment, infection control products, and the high risk of creating aerosols with the potential of spreading the disease to our patients, staff, and ourselves. The ADA released the recommendation later that day with the same request. Since that recommendation put most dental offices producing less than 5% of their normal production, we realized we need an executive order in order to have dentists qualify for state and federal assistance. The Executive Committee met later in that same week and voted to request this recommendation be a mandate from our governor. On March 20th, Governor Whitmer issued Executive Order 2020-17 that limited the provisions of dental and medical care. This executive order will stay in effect for dentistry until the state of emergency order is lifted or actions are taken to remove dentistry. It was this executive order that allowed dentists and their staff to be able to file for unemployment benefits, allow practices to qualify for EIDL and the PPP loans. When the decision was made, we were not the only state, nor the only country to make these recommendations. Immediately following this recommendation, a work group was formed of MDA volunteers to develop a list of essential versus non-essential dental treatment. This was to help guide our members and the dentists of Michigan to make informed decisions on treatments that were to be performed during the unprecedented time. The Michigan Dental Association, being a leader state association, moved all of the COVID-19 information to the front of the firewall on michigandental.org and made it available to both members and non-members. We knew this would provide the most timely and accurate information to benefit members, fellow dentists, and the public at large. Shortly thereafter, the governor issued the Stay Home, Stay Safe order. The MDA staff had already been working remotely on voluntary basis and took extra steps to go fully virtual. This was not an easy task, but we wanted to make sure all of our staff was compliant with the governor's mandate and could continue to stay healthy while still working. Since that day 6 weeks ago, the MDA has gone into overdrive. The Board of Trustees has had numerous virtual meetings to discuss new information, since its changes by almost the hour. Necessity is the mother of invention, and our MDA has been there and done that. We have conducted multiple webinars to help keep our members informed and up to date on issues like CARES Act, infection control, and stress management. Our first webinar had over 1,300 participant viewers. Did I mention it was all for free? What a great member value. The response has been overwhelming, and we at the MDA and myself thank you when we needed your input the most. I am proud to be a part of the MDA that puts their members and the public first in times of adversity. We have issued journal e-news alerts and special editions on almost a bi-weekly basis. On our members' behalf, we engaged with the governor's office and the Michigan Department of Health and Human Services to be sure state officials receive regular input from organized dentistry. We have met with dental benefit companies to advocate for financial support and the relief to help keep provider networks viable. We made requests on teledentistry, coding, temporary fillings, and much more. The staff has been actively answering 100 member dentists and dental team member questions over the phone and email. I know I have received more email, Facebook Messenger, and phone calls than ever before. Thank you to all who have contacted me. We want to be your #1 resource for accurate and timely COVID information. Our MDA continues to pay it forward and help other members and dentists in times of need. We engaged and worked with the Michigan Health and Hospital Association and the state of Michigan to facilitate the donation of proper distribution of personal protective equipment. Due to the cancellation of our Mission of Mercy in June, the foundation donated our personal protective equipment and infection controls to the first responders of our state. This has helped many in our state. Thank you for all who donated and organized those drives. Speaking of helping the public, we changed our landing page on SmileMichigan.com to help educate the public on when and how to seek a member dentist in a dental emergency. Now the time has come for us to look ahead to dentistry's return to practice. I formed a task force to prepare recommendations for the Michigan dentists so that they will be equipped to do so safely. Our recommendations will be coming out shortly. They will go not only to you, our members, but also to the Governor Whitmer, so she may be assured that dentistry is ready to return to work. I know this time of uncertainty, but one thing I am certain of, I am proud of the MDA accomplishments this year, and especially the hard work of our volunteer leadership and staff related to the COVID-19 pandemic. I know that the MDA will continue to address dentistry's challenges in the coming months. This is not a situation that will resolve quickly. I look forward to continuing to be involved. I may be saying farewell to my term as president, but I will continue to be a loyal and devoted volunteer. Now I have a short message from my two daughters, Lexi and Maggie.
Thank you, Mom, for letting me be president.
Thank you for letting my mom show me what it means to be a true leader. Thank you.
And thank you all for the opportunity to serve as your MDA president.